So my name is Gloria Wong. I'm from the Hong Kong University and I work as an assistant professor at the Department of Social Work and Social Administration there. So I do mainly research and teaching. So at the university, I work on research related to mental health services and in particular older persons' mental health. So I work with governments and also non-governmental organizations to look at and help them develop and evaluate their mental health related services, such as dementia, psychosis, and depression in older persons services for them. So in Hong Kong and perhaps in the greater Chinese context, I would say that the three main priorities in long-term care service would be, first of all, we are trying to rebalance or redress the resources allocation between community care service and residential care services. So there has been an ongoing discussion about focusing on aging in place, but the allocation of resources is not reflecting this policy agenda. So that's one thing, one main priority that our long-term care policy is trying to work on. And the other issue that we have on hand is the shortage of manpower, in particular frontline care workers. We are constantly having around 30% shortage in terms of manpower in long-term care. So currently we're looking at potential strategies to address the manpower issue that we have on hand. So one potential strategy is task shifting from the more professional-driven approach to more, say for example, general practitioner and frontline worker taking up more of the tasks in terms of long-term care. So that's one potential policy priority. The other one is productive aging. So we're encouraging older persons to become more actively involved in the production of goods and services. So that may also help relieve some of the pressure on our long-term care system caused by low manpower. And the third one is we are looking at preventive health strategies so that the demand on the long-term care service would be lower. So that's the main three strategies that we're looking at to address the manpower issue. So the third priority that we are looking at is to promote personal budget or choice for the care receiver or the older person themselves. So there has been new strategies, new policy strategies such as by giving out vouchers so that the consumers themselves can choose what kind of care is most suitable for their needs. So that's the three main policy priority I would say in terms of long-term care in Hong Kong. I would say that, so say for example, aging in place has been a policy priority for a long time. But what is new in the past 5 years would be personal budget or promoting choice. So that's why we are seeing quite a lot of new government pilot projects such as community care service voucher and also carers allowance, which we are helping the government to evaluate at the moment. Yeah, so in Hong Kong, we have this standardized assessment for gatekeeping for accessing government-funded long-term care service. So far, the system has not been changed from early 2000 to now, so 18 years already, and the assessment only leads to the three types of categories that of service that older persons would be entitled to. So after they have the comprehensive standardized assessment, they will be allocated either to community care service, residential care service only, or dual option. So which is not really helpful. So if I would have a chance to change that, we would really like to see how that assessment can lead to a more sophisticated or complex case mix model or resources utilization grouping, so that it will help more rational resources allocation. So that's one thing that I would like to see. I would like to see changes in our long-term care policy. And related to that is, I think we are underutilizing this type of assessment because so far we're using it only for gatekeeping to long-term care service. But in fact, if this assessment can be used in terms of looking at the quality of care. Say, for example, we can develop quality indicators that would help improve, in general, the quality of care in long-term care service. So as I mentioned, it's a more new policy priority to promote choice and personal budget. And for that, we have yet to be able to understand what is the best way to upkeep the service quality or quality of care, while at the same time allowing more flexibility in terms of care providers, in terms of the diversity and the type of care providers who can provide care for our older person. So how do we upkeep the care quality, or what is the best way to, in terms of stewardship for the public dollar? That's one piece of research that we think is still yet to be done. I would say it's pretty high, so I would give a 7 because of the rapid population aging in our area. I would say that's a 3 because the system is just too complicated and fragmented for our general population to be able to understand. For that question, I would give a 6 because in general, Hong Kong long-term care service system is quite comprehensive. It's just a little bit fragmented, so that there needs more consolidation and coordination. I will give 4 for that question. The support for carer has not been the main focus in our long-term care policy, but I am seeing some change in that direction. For this, I would give a 3 out of 10. We have 2 different bureaus for health and for social care, and at the moment they are not talking a lot to each other, but again, we're seeing some new initiative we call medical social collaboration, so hopefully that will improve.